So other technique for treatment of cystic lesion of the jaw include marsupialization, which is conservative treatment actually, followed by inoculation, which means second surgery. So here, if the cystic lesion is large enough, so we can use marsupialization. When the cystic lesion decrease in size, we can use inoculation to remove the entire cystic lesion. Actually, inoculation can be done after 3 to 6 months. That means, first of all, in a marsupialization, when the cystic lesion decrease in size, after 3 to 6 months, we can use inoculation. Sometimes we can use inoculation with bone graft, as I mentioned before. This is not very common in case of the cystic lesion of the jaw because the healing potential of the bone of the jaw is very high. So we don't need bone graft or bone substitute. Resection and reconstruction of the defect. Actually, this is very rare used or sometimes may be used in case of multiple recurrence. So multiple recurrence of the cystic lesion or sometimes of the multilocular cystic lesion, that means cyst within cyst, or sometimes in case of cystic lesion that is highly possible to transform into malignancy. So in this case, resection of the jaw. The resection could be partial or could be complete, and then followed by reconstruction of the defect by bone graft or by any other means. Here I have to mention that in case of inoculation, actually after removal of the cystic lesion, because inoculation means cystectomy. Sometimes some people used actually the another or adjunctive technique, and this adjunctive technique includes cauterization. Sometimes people use material to cauterize the epithelium surrounding the cystic lesion to prevent the recurrence of the lesion. Sometimes people also use electrical cauterization, also, which is the main principle. And some people actually using cryosurgery. Actually, this is mostly used in case of cystic lesion in the ramus of the mandible or in the maxillary tuberosity. But actually, it can be used actually, but it is very rare. So this is the end of the lecture, and thank you for your attention.